Before you spend another $30, $40, or even $60 on joint support capsules, look inside your kitchen cabinet. A small jar of yellow spice may contain the same famous plant compound advertised on many expensive supplement labels. That spice is ground turmeric. But here's what the advertisements rarely explain. The inexpensive spice, the concentrated supplement, and a prescription pain medicine are not identical. Turmeric should never replace medical care without your doctor's approval. However, it may offer a remarkably affordable, food-based way to support painful, stiff knees. And in a moment, I will show you exactly how to use it safely. Joint pain becomes expensive quickly. One bottle promises flexibility. Another promises cartilage support. A third contains curcumin, black pepper extract, ginger, or several ingredients combined. Soon the monthly cost becomes difficult to justify, especially on a fixed income. You may also rely on common pain relievers when your knee becomes uncomfortable. These medicines can be helpful and sometimes necessary, but certain anti-inflammatory medicines may cause stomach, kidney, or cardiovascular problems in some older adults, particularly when used frequently. That does not mean you should suddenly stop taking them. It means you deserve to know about additional tools that may support comfort without automatically adding another expensive bottle to your shelf. Welcome to Apex Ledger, where we examine affordable foods through real science, not miracle promises. The spice is ground turmeric. Turmeric comes from a plant related to ginger. Its golden color comes partly from natural compounds called curcuminoids. The best known is curcumin, the ingredient displayed prominently on many premium joint supplements. To understand why researchers study curcumin, consider what happens inside an arthritic knee. Osteoarthritis is often described as simple wear and tear. But the knee is not merely a rusty hinge. It contains cartilage, bone, joint fluid, ligaments, tendons, and a thin lining called the synovial membrane. As osteoarthritis develops, cartilage can become rougher and thinner. The surrounding tissues may become irritated and release chemical signals linked with inflammation. Those signals can contribute to pain, swelling, and stiffness, especially after sitting, first thing in the morning, or while climbing stairs. Think of inflammatory signals as several smoke alarms ringing inside the joint. One alarm is useful. It tells the body that something needs attention, but when several alarms keep ringing, the joint may remain sensitive during ordinary movement. Curcumin appears to influence some of the pathways that help produce these signals. In simple language, it may help turn down the volume. That does not mean turmeric rebuilds cartilage, removes bone spurs, or creates a new knee. It cannot correct a torn meniscus, an unstable joint, gout, rheumatoid arthritis, or an infection. It also does not act like an emergency painkiller. Instead, it may support a less inflammatory environment over time. Clinical trials and research reviews have reported possible improvements in knee pain, stiffness, walking, and daily function with turmeric or curcumin products. Some participants have reported that ordinary activities such as standing from a chair, walking around a store, or using stairs became a little more comfortable. But there is an important limitation. Most trials use standardized extracts, not ordinary kitchen turmeric. These products contained measured amounts of curcuminoids, and some were specially designed to improve absorption. The doses, formulas, and study periods also differed. One study may use a concentrated curcumin extract. Another may use a whole turmeric preparation. A third may combine curcumin with another ingredient. This makes it difficult to say that every turmeric product will produce the same result. Think of coffee. A weak cup, a strong espresso, and a caffeine tablet come from the same basic source, but they do not deliver the same amount in the same way. Kitchen turmeric and concentrated curcumin supplements have a similar relationship. Ordinary turmeric contains curcumin, but curcumin is only one part of the spice. The body also absorbs curcumin rather poorly. This is why some manufacturers add oils, special delivery systems, or piperine from black pepper. Their goal is to help more curcumin enter the bloodstream. However, greater absorption is not automatically safer. A stronger effect may also mean a greater chance of interacting with medication. Rare liver injuries have also been reported with some highly absorbable turmeric or curcumin products. This is especially important for adults over 50 who may already be taking medicine for blood pressure, blood sugar, heart rhythm, cholesterol, or blood clot prevention. So the honest scientific conclusion is not that turmeric replaces every joint pill. It is that turmeric is a promising complementary food. It may provide modest, gradual relief for some people with knee osteoarthritis. Others may notice very little difference. That balanced message may sound less exciting than a miracle claim, but it is far more trustworthy and far more useful. Here is a practical way to use it. This is a culinary routine, not a medical treatment dose. Begin with a small food amount, approximately 1/4 teaspoon once a day. Mix it into food rather than swallowing the dry powder. At breakfast, add it to scrambled eggs, an omelet, or savory oatmeal. At lunch, stir it into lentil soup, beans, chickpeas, or vegetable soup. At dinner, sprinkle it over rice, roasted vegetables, chicken, fish, potatoes, or stew. You can even add a small amount to a homemade salad dressing with olive oil and lemon juice. Choose one meal you already eat regularly. Keep the turmeric beside an ingredient you normally use with that meal. For example, place it beside the olive oil, salt, or oatmeal container. This makes the routine easier to remember. After 1 week, check how your stomach feels. If you have no reflux, nausea, diarrhea, constipation, or abdominal discomfort, you may choose to increase to approximately 1/2 teaspoon per day. You can use it in one meal or divide it between 2 meals. There is no need to consume large spoonfuls. More is not automatically better, and large amounts may upset the stomach or make food unpleasantly bitter. Turmeric is often paired with a small amount of fat because curcumin mixes more effectively with fat than with plain water. A normal meal containing olive oil, eggs, yogurt, nuts, seeds, fish, avocado, or coconut milk is enough. You do not need a heavy, greasy meal. For example, you might add turmeric to eggs cooked with a teaspoon of olive oil. You might stir it into lentil soup containing a small drizzle of oil. Or you might mix it into plain yogurt with cinnamon and a few crushed walnuts, provided those foods fit your diet. Black pepper is frequently recommended because its natural compound, piperine, can increase curcumin absorption. But this advice requires caution. A small culinary pinch of pepper is very different from a concentrated piperine capsule. Increasing absorption may also increase the possibility of medication interactions. If you take several prescriptions, ask your pharmacist before deliberately using black pepper extracts to make turmeric stronger. Do not assume that stronger always means healthier. Next, give the routine a fair test. Turmeric is not something to judge after one meal. After discussing it with your healthcare professional, use it consistently for several weeks. Do not begin turmeric, 3 new supplements, a new medicine, and a completely new exercise program on the same day. If everything changes at once, you will not know what helped or what caused a side effect. Keep a simple notebook. Each evening, record 3 things. First, rate your knee discomfort from 0 to 10. Second, note how long your morning stiffness lasts. Third, track one useful activity. That activity might be standing from a chair without using your hands, walking to the mailbox, shopping for groceries, gardening, or climbing one flight of stairs. Look for a meaningful pattern rather than one unusually good or bad day. Perhaps your pain changes from 7 to 5. Perhaps morning stiffness lasts 15 minutes instead of 30. Perhaps you can walk for 20 minutes instead of 10. Or perhaps nothing changes. All of these outcomes are useful information. If you notice no meaningful benefit after a consistent trial, you do not need to keep forcing the routine. Turmeric does not work equally well for everyone. And remember, turmeric should be only one part of a larger joint care plan. Gentle strengthening helps the muscles around the knee share the workload. Low-impact activities such as walking, cycling, swimming, or water exercise can help preserve movement and function. For people carrying excess weight, gradual weight reduction may decrease stress on the knee. Appropriate footwear, good sleep, activity pacing, and physical therapy may also make an important difference. Think of turmeric as one instrument in an orchestra. It may contribute something useful, but it cannot play the entire piece alone. Turmeric may cause heartburn, nausea, stomach upset, diarrhea, or constipation. Stop using it and seek medical advice if you develop persistent nausea, unusual fatigue, poor appetite, dark urine, or yellowing of the eyes or skin. Always consult your doctor or pharmacist before changing your routine, especially if you take blood thinners, diabetes medicine, several prescriptions, or have liver, gallbladder, bleeding, or digestive problems. Do not stop prescribed medicine because of this video. If your knee becomes suddenly red, hot, severely swollen, injured, locked, unstable, or too painful to bear weight, seek professional assessment. The lesson is not that a 50-cent spice magically replaces every pill. It is that an inexpensive supermarket ingredient may support the same goal: less stiffness, easier movement, and greater comfort, without automatically requiring another costly supplement. Have you used turmeric regularly in your meals? Did you notice any difference in your joints or digestion? Share your experience in the comments. And for more calm, science-based ways to protect your health without wasting money, consider liking this video and subscribing to Apex Ledger. Your health deserves evidence, and your budget deserves respect.